Hi, I'm here with Sarah and Teresa, and we're going to be performing a procedure called what, Sarah?
The procedure is called PDT, and it stands for Photodynamic Therapy.
And what is it used for?
PDT is really used for precancerous spots, and it helps to treat precancers before they turn into skin cancers. Patients also get some cosmetic results. You'll get rid of some of your brown spots, and your skin should appear smoother after the procedure as well.
Go over the procedure. How does it start, and what is the procedure?
Pretty much the patient comes in, and this is called a Cara stick. This has something called Levulan in it, and we'll put this on a patient's face for about an hour and a half and just let it soak in.
Okay.
During that time, the precancerous cells selectively pick up the solution, and when we use the blue light to light it up, we actually get the reaction. Patients turn a little bit red and then start to peel for a couple days.
How painful is it?
Under the blue light, it's really not too painful. You know, there is a little bit of a burning or tingling sensation, but it's nothing that's unbearable.
You've had it before? You've had this procedure before?
No, this is my first time.
Oh, okay. And you're getting it because?
I have basal cell, and so we're actually just trying to treat some of the precancerous cells before I actually have the Mohs surgery done.
Okay, so what should she expect?
So really after the procedure, she can expect to be red probably for about 3 to 4 days afterwards, and then peel for a couple days. An important thing is for 48 hours after the procedure, the patient needs to stay out of the sun. The sun actually will keep activating the solution just like the laser light that we use here.
Oh,
So
wow.
It's important to really stay out of the sun for 2 days afterwards.
As far as the reaction from each patient, what should each patient expect? Should it be a little more lengthy, the recovery process, or what should each patient expect?
Each patient is a little bit different in that some people with more damage tend to get more of a reaction. People with less damage actually get less of a reaction. So the degree of damage depends how much absorption of the solution that you're getting, and therefore how much reaction to the laser light.
So the more damage you have, the chemical absorbs more into the damaged skin cells?
Exactly. So the parts that are damaged, the precancers and the cancerous cells, are actually going to selectively absorb this chemical a lot more than someone if they don't have too much damage. So therefore the patient's going to be a lot redder, a lot peelier, as opposed to someone with very little damage that may just be a little bit pink.
Will she have to take any kind of pain medicine afterwards, or?
Most patients don't need pain medication. You know, Tylenol occasionally if they're a little bit tender, but for the most part, no pain medication is needed.
Is it really necessary if I'm going to have Mohs surgery done? So what would be the reason for me to have this done before my Mohs surgery?
You know, the benefit to doing it before Mohs surgery, or even in a patient that has a lot of skin cancers, is that you're treating the whole field around the lesion, whereas Mohs surgery, it's dealing with an individual spot and you're treating that cancer, but the surrounding field on the face probably has a lot of precancerous spots, and so it's actually a very preventative treatment in that you're treating everything and hopefully preventing future Mohs surgery.
Oh, very good. So it's preventative while it treats.
Yes, it's preventative while it treats, and it treats all the precancerous spots and hopefully prevents the progression to basal cell and squamous cell.
When can she do the treatment again? Will it be necessary to do it again in the future? Or?
You know, I do have some patients that may do the treatment again. Typically, maybe 5 to 6 months later, we can think about a second treatment.
I mean, I wish that, for my first surgery, and of course I know that was like 6 years ago, that I wish we'd been more educated and known about some of these other steps, because then maybe I wouldn't be looking at going through a second Mohs surgery now,
Right.
6 years later.
Yeah,
You
no,
know what I mean?
absolutely.
So
Absolutely.
that's a shame. But now that's good. Maybe it'll prevent me from having to have a third one later on.
Absolutely, and definitely doing 6-month intervals, potentially doing the PDT, and she's actually also using Aldera, which is it's a cream that helps treat precancerous spots. So there's a couple different things you can do kind of in conjunction to treat the